Again, I want to welcome everyone to today's webinar, sponsored by the Region 7 Disaster Health Response Ecosystem, and titled our Activating Your Healthcare Coalition Lessons from the Real World Experiences. Our speaker today is Mr. Fidel Cavillo. Mr. Cavillo currently holds a position as the Emergency Management Operations Coordinator for Special Populations for the Southeast Texas Regional Advisory Council. As the Emergency Management Coordinator, he's part of a team responsible for the implementation of the Hospital Preparedness Program for 25 counties with a combined population of over 8 million people, 180 hospitals, and over 1,000 nursing homes and assisted living facilities, and numerous EMS agencies. With over 19 years of experience in working in disaster preparedness and response in emergency management, public health preparedness, and healthcare preparedness, he has developed a wealth of knowledge over dozens of response activations. Mr. Cavillo's largest disaster response was Hurricane Harvey, assigned at the Catastrophic Medical Operations Center, with the responsibility of overseeing information management, brokering requests for assistance and supplies, coordinating patient movement, and providing situational awareness across emergency response disciplines within a 25-county region. His last regional activation to support the SETRAC region was for Hurricane Beryl. And with that, I am going to turn it over.
Oh, Thomas, thank you for that introduction. Thank you everyone for being on this webinar today. I'm real excited to give you some of the information that I can provide to you as it relates to the title, lessons learned from real world experiences by activating your healthcare coalition. I'm sure we have some coalition members on the call. We also may have some hospital members as well. So the focus is activating your coalition and getting that purpose out there. And a lot of it is, I'm going to give the overview of our organization, kind of who we are, how we get funded, some of the background processes that we have in place here in our region and throughout the state of Texas to help us doing activations as well. And then I'll be going over our different initiatives for our special populations and what that is. Go ahead and hit the next slide, Thomas. So, it's just an overview that I just mentioned. We'll go over SETRAC and special populations. What does that mean for us as for special populations group? What do we do to keep them in our coalition? How do we get them here? And then also the last part is activating for a real world event or a small type of an emergency disaster response. That's may not be a large regional response, but a little bit more locally compared to the region we cover. Next slide. So we're a nonprofit 501c3 agency that manage our coalition. We receive the funding through a hospital preparedness program through the state of Texas. We're the subrecipient for the Department of Health Services to implement the hospital preparedness program. The way Texas does it is they divvy up the initiatives to different parts of Texas, and those are broken up within trauma service areas in Texas. So there's 22 of those areas in Texas, but only 8 of those trauma service areas receive funding to do or to implement the healthcare preparedness program. If you notice, I always go back hospital preparedness and healthcare preparedness because I've been doing this for quite a while. Before it changes to the healthcare preparedness program. Getting back to it, so you got trauma service areas, and they're geographical areas in Texas. Each area they're responsible to develop a trauma system, working with their hospitals and the pre-hospital agencies and services within that region. But again, we cover 25 counties in our area, and we are the sole recipient to do this region for healthcare preparedness and response. You all are familiar with your grant requirements, and those are the ones we have to also perform here in our area. Next slide. So this is just a good map of the area that we cover. Listed you see on there on the big Texas map. We have our 22 trauma service areas, and out of those 8 receive healthcare preparedness funding, and they're broken into regions. So on our area, we have the Q H&R section on the southeast Texas part of Texas. If you see on there in the colored area, we also internally we break it down within corridors in that 25 county region for us to better manage our collaboration, our grant requirements, and also each one of these 5 areas has different set of hazards. So each one does their own regional hazard vulnerability assessment that they work on as a corridor. So we have these 5 different corridors throughout our region. That little red dot in the middle is our downtown corridor. We have close to 50 facilities, hospitals within that area. So that's its own corridor in itself. We also have a breakdown of our region. We have 277 cities that we work with. We in our region alone, we have 24% of the disabilities in the state of Texas. Our portion that I work with is our special pops, which is our nursing homes and assisted living and ICF. So we have over 1,000 of those in our region that we work with. We have over 2,000 home health and hospice agencies. And we also work with all the FQHC clinics and all of these other clinics and surgery centers within our region to have them be part of our coalition. Next slide. So just to give you a little bit of a background, here in Texas, we do have what we call the Texas Emergency Medical Task Force. It's the best way to kind of get the scenario about it. It's like almost like a DMAT team, but it's broken up in different strike teams, for instance, and it is funded through the healthcare preparedness program that the state of Texas receives. They divvy out a portion of that to put this to implement this program. And recently, the state of Texas, through the general fund, also provided some additional funding to continue the Emergency Medical Task Force mission throughout the state of Texas. So these are deployable teams throughout the state. Similar to DMAC, as I mentioned. However, there's different strike teams, so we do have different components. Here in Texas, we have about 16 ambuses throughout the state of Texas, and that's its own coordination strike team of EMTF assets that the work group has together. We also have what we call a mobile medical unit, which are your deployable medical tents that we put out there during a response, and that comes with its own set of staff and physicians, nurses, and within that medical unit that gets deployed out. The last time we've used it was during Hurricane Harvey. We had several of these mobile medical units throughout our region. We also have our ambulance strike teams, which consist of just ambulances that we have here throughout the state of Texas, and within every component in the state, there's 8 sections with an EMTF component or a portion of that, and we're one of the 8. So we have our ambulance strike teams here on our region, and we also have RN strike teams as well, and we also have what we call medical incident support team members, these folks can be a paramedic, could be a nurse, could be a firefighter, someone. It's basically a liaison that gets sent out to either a hospital that's going to be evacuated or a location that needs some coordination with our operations center. These medical incident support team folks go out there to support that, and they're our eyes and ears on the ground when we're evacuating a hospital, a nursing home, or activating our mobile medical unit. We also have staging managers as we move in all of our assets, our ambulances and our ambuses. We have staging managers that coordinate and set up that staging process as well with those assets. This is an overview of our EMTF. And within our area, we manage the EMTF 6 component here in our SETRAC region. And there is one state program manager that kind of oversees the EMTF programs throughout the state that we work with. Next slide. And the reason I gave you that little background of the Emergency Medical Task Force is because it's one of our assets that we use during a response, either a large scale or a local regional response. So I really wanted to make sure I mentioned that as I move on through the presentation when we get down to the activation piece and how that support comes in. So here in our region, what are our special populations? Basically, we with that CMS new emergency preparedness rule in 2017, it kind of pushed a lot of these facilities and agencies to engage in emergency preparedness. In our area, our agency, we decided to have a designee to work specifically with this specific population. So we classify these as either our non-acute hospitals, which are our long-term care facilities, our assisted living, our hospice, home health, our dialysis centers, our intermediate care facilities for individuals with intellectual disabilities, our clinics, surgery centers, basically anything that's outside of an acute hospital or outside of a long-term a long-term care hospital, outside of rehab hospital. Anything outside of that, they kind of fall in our special populations group. As we know, hospitals have been preparing for disasters for quite some time now. So this is a new group to, I guess I would say, to the field. They're new members. So this is what we kind of cut out as our special populations group, that we have someone like myself specifically just working with this group to engage them in our coalition. There's a lot of challenges to that, and I'll speak to that in the next slide. So, of course, in 2017, when the new rule came out, these facilities were not much aware of emergency management, disaster response, some of these new regulatory requirements that they had to come up with and participate with emergency management. So we had a hard time having them come into our coalition. It was really a struggle to have them to participate in our coalition. Again, when you look at long-term care facilities, assisted living, these folks are not familiar with emergency management and disaster response. For us in our coalition that work with emergency management, disaster response, this is second nature to us. To them, this is a whole new world. So we're trying to get them and come on board. So when that first rule came out, the first few years or so, it's hard to get them to come in. So they weren't coming in as part of our grant requirement. As of 2012 and 2015, there was that big push to develop coalitions and have all these additional agencies involved in your coalition. Next slide. So what did we do in our area to kind of get these folks to come in, or get these new agencies to come in? First off, the first 2 years was, hey, this is the new CMS rule. These are the requirements you have to meet as an agency or as a facility for your CMS requirements. So we basically, on our end, we had to also study some of the new regulatory requirements for CMS. So we then developed these emergency preparedness workshops that we went around our region to implement those workshops throughout the year. Our target goal is doing it usually right before hurricane season starts, which is June 1st. So we try to start these boot camps in May and in June and continue on forward. So that's one of the things that we did to get them a little bit more involved. And then we have to conduct exercises as your healthcare preparedness grant requirements. A lot of the exercises are pushed towards hospital-based exercises, which is you have to develop your CBRNE regional response plans, right? You have to do an exercise for that. You have to have a burn plan, do a burn exercise for that. Your pediatric plan, and do PD exercises for that. We have to do what we call, the Mercy annual Mercy exercise as well. So some of those exercises are not too relevant to our long-term care facilities or assisted living, dialysis centers, surgery centers, home health, hospice. Is not really geared toward them. So it was a big turnoff for them because they're like, that's not relevant to what we do at a day-to-day operation. So we then developed exercises that were more relevant to those type of agencies. So what we do now is we hold we inclement weather exercise. Basically, it's a hurricane preparedness exercise where we talk about the exercise is basically a evacuation exercise of a nursing home or an assisted living or shelter in place for these type of facilities, but also hospice, home health. They have to shut down their operations. What are they doing when they have to look for or follow their clients that are out at home? So we design the exercises to focus more on what they need have to be done throughout the year, make it a lot more relevant to them. So that's what we do now is we implement an exercise on an annual basis where they meet their CMS regulatory requirements for an exercise, for a community exercise. But on our state side, our state facilities or our state regulatory that are not CMS, like our assisted living facilities, for example, they also participate in these exercises because we conduct the exercise the same way for them to meet that requirement. What do we also do? We meet with our state regulatory that oversees all of these facilities to get a good understanding of what is it that they're searching for or looking for when they do their site visits. What are they specifically are they looking for, or what are the gaps that they're seeing when they go out and visit these facilities? So we meet with them and get that buy-in with them as well. When they have their annual provider meeting, for example, or any information that they send out for emergency preparedness, we make sure they send out our information, our contact information, so they can get engaged with us and be part of our coalition as well. The other thing we do is we also work with different associations. You have your long-term care association, you have your assisted living, or end-stage renal disease, home health and hospice. You have those associations that we also work with as well to make sure that they're identifying with us and we're providing them information so they can get more involved in what we're doing on the day-to-day operations. Our main goal is to get them prepared for a disaster or any type of other event. The last thing that we want to do or be faced with when we're actually activating for a response is getting these calls from facilities that do not understand what our role is, our agency's role is for emergency management, and who to contact for assistance or resources or any type of support. So we want to make sure we engage them early. They have a good understanding. And that's one of the things that we include in our emergency preparedness workshop as well. Make sure you're working with your end-stage renal disease network to make sure they understand what you're doing, how to get in touch with them, what they might have different contact information that they might want you to provide to your stakeholders. Our biggest goal here for our agency during a response is to make sure that either dialysis patients or nursing home residents that are in nursing home do not end up at a hospital, because in the beginning, a lot of these nursing homes and assisted living, their plan for evacuation was to go to the hospital. That's what they would evacuate to. So, we had to break that barrier and give them that education piece, is like hospitals are not equipped to take your residents from a nursing home to come into the hospital because you have to evacuate. Or dialysis centers that fail to plan and bring their clients in for treatment, now they want them to end up at the hospital ED for their dialysis treatment. So we know hospitals are not really designed to do your dialysis treatment for this on a day-to-day basis. It's more of their inpatient. So we make sure that we engage with our end-stage renal disease, and we also engage in their exercises. So they also understand there is a coalition that's responsive and also working with dialysis centers during the response. So these are the different strategies we kind of been implementing, and they're ongoing. With these different agencies. Is also one of the biggest gaps with these agencies as well is they also change personnel. So we have to go back to square one and give them the education of what our organization does and what our coalition does. Next slide. This is just an overview of our preparedness boot camps. Again, I just want to remind you all, we'll get to the response component, but it's important for me to provide this to you to get a good foundation of how everything kind of plays out during the response. So this is one of our an example of our emergency preparedness boot camps that we do hold every year. We do 5 of them per year throughout our 5 different corridors in our region. So basically, we're reviewing any new Senate bills that the state passes or any other CMS rules changes. Anything like that, we provide to the attendees. We also coordinate with our local offices of emergency management, our local public health office, our FEP program, and our state emergency management office as well, to provide an overview of what their role is during a disaster and how they want them to be prepared. These special populations should be prepared for a response, and how the locals will work with these special populations group during a disaster, and having a good understanding that there is a process in place when there is disaster going on, the declaration. So we give them that big overview of how locals and state respond to a disaster, what the expectation is for local entities, but also what is the special populations group responsibility to have in place working with the locals. We also do what we call hands-on workshops as one of our breakout sessions as well. We go over emergency notifications, what we have in place here. We use EM Resource. We also have the locals review how they can sign up to their local, either their county or their city notification system. So we kind of go over that and get them on the system during this preparedness boot camp. We also go over bed reporting, similar to your bed reporting during COVID, and your annual or your monthly drills that you may do, getting hospital bed information. We also working on having something similar in our region. We will have long-term care or assisted living facilities give us a bed reporting of how many beds are open or available if we have to evacuate facilities, if they can support housing some of these folks from a nursing home to nursing home or assisted living to assisted living. So we're working with that process. So we give them an overview of what is EM Resource, how do we use it, how do you get on it. So we give that hands-on training as well. What we did this past year is, we did a more formal long-term or a long day review of how to develop an exercise. How do you conduct an exercise? Again, these, like I mentioned before, these facilities, these administrators, they don't do emergency management, disaster response, day-to-day operations. We do, as a coalition, as an agency that does this, wherever you're located. You do this every day, or it's part of your processes. So we went in there for this year's boot camp. As part of it, we went in there and showed them, this is what an exercise is. This is what a tabletop exercise is. How do you develop a tabletop? What is a full scale? What is a functional exercise? How do you develop each one of those? And we went in and also went over what is an after action report and your improvement plan. You know, because they all have to meet that regulatory requirement to have an after action improvement plan for the CMS requirement. Here in Texas, regulatory for the assisted living facilities, state regulatory, they make sure and they check those as well. So we kind of go over that so they understand, like, if you miss the exercise that we put on, you have the ability to conduct an exercise at your facility, at your agency on your own. So we do this. This is one of our boot camps that we did, and we pushed that this year. So how did it work this past year? The morning session from 8 to 12, basically we did how to conduct an exercise. In the afternoon, we did a tabletop exercise. So they went away with the credit for a community tabletop exercise as well. So that's how we did it this year. And we also learned from these groups is we also learn, and this is, you might learn this as well as you start working with these groups. When you have a large group of nursing home administrators or assisted living, some of these folks don't like to ask a lot of questions. So as part of our boot camp the past 2 years, we have a session where we break them down in smaller groups, and they have a one-on-one with the local office of emergency management to ask them more intimate questions about responses and how they operate. Because we had them in a big group a few years back, they didn't ask any questions, and I know they had questions. So these past 2 years, we broke them down in smaller groups, so there was a lot more interaction with the local office of emergency management and the special population attendees. So that's one of the things we implement. Next slide. This is our target audience: long-term care facilities, nursing homes, hospice, home health, dialysis centers, or anyone that needs any type of education. So we ask them to bring anyone else, if it's a clinic, if it's another dialysis supervisor that's new. We even try to get hospitals to come in, but it's the boot camp's not targeted to hospital emergency preparedness. It's mainly for long-term care and our special populations group. But we still invite hospitals, new folks that are in a hospital setting, to get an understanding of what is special populations and what is their role for disaster response, and what preparedness activities they have to do as part of the requirement. So we also engage them as well as our audience group as well. Next slide. Here in Texas, here in our region, we also have what we call pink vest initiatives. This is another way to get them to come into your coalition. So although every nursing home and assisted living facilities, this is basically their evacuation vest if they have to evacuate for easy identification. But we provide this to them at no cost. So this is like an initiative, like, hey, if you be part of our coalition, you come to our exercises or our boot camps, we'll provide you the pink vest for your facility is based on your licensed number of beds that you have. So this is another way of kind of like enticing them to come and be part of the coalition, because you'll have either sister facilities or maybe one director left one nursing home or assisted living to go to a different one, and they're like, hey, we don't have pink vests. How do we get our pink vest? So we get those facilities involved in our coalition. So it's a pink vest, easy to identify. We go over it in all of our boot camps and all of our education with them, and we offer this to them at no cost. Next slide. And Thomas, you can click on each one. Thank you. So these are some photos that we know that our education is going out there. We know that these pink vests do work in our region. It's now a state initiative to push these out to all the facilities in Texas. These are real events. These are evacuations. The two slides that you see on your right, well, actually all of them specifically, but they're different parts of Texas. The ones on your right, that was over in our Beaumont area, which is right between it's right on the border of Texas and Louisiana. In that area, they got flooded during Harvey. This is a nursing home facility that was being evacuated. If you see, there's a woman in a wheelchair with the pink vest on, and behind her you see the bags of clothes that's going along with them because they're being evacuated. On the bottom, you see the nursing home beds with the patients on there, or the residents that are on there, and they all have a pink vest. So we know this works. On your left side, you see that nursing home that was on the well, actually it was not a nursing home, it was an assisted living facility with about 11 residents that flooded. If you see, they all have their pink vest on for this response. So a little bit of background on this facility. Even though it says nursing home, it was an assisted living facility. At that time when we made contact and they made contact with us, they're a very active coalition member. They did not need any assistance evacuating. They did not have any water issues or flooding issues. After they hung up with us, within 2 hours, their facility got flooded with the water that came in so quickly that they couldn't even evacuate the facility on time. So this is why you see this picture that was on there, but it was not failure of planning. It's just that at the time they did not have to evacuate from the flooding from all the rain that was the downpour of rain that was going on in that area. They were fine. But within 2 hours, that water came up so quickly they couldn't evacuate. So they were basically stranded till we got some high water assets out there to them. So just to give you an overview on that facility. But understand, this is a education piece. They all have their pink vests on. Next slide. So, what is your benefit to get these facilities involved in your coalition? Well, we've had real world responses. So we did have our tornado come down and hit a nursing home on January 2023. There was 64 residents within that facility. So what happened in that response? We're not activated as our coalition or as in our operations center for this type of an event, because it was a quick event with a tornado that happened with the weather event. So we were all mobile. So we activated our ambulance strike teams to go out there and support this nursing home. We have 5 ambulance units out there, 1 ambus that was sent out there to support this facility for evacuation and response. At the same time, we actually use EM Resource to notify all of our stakeholders to provide some support if they can house these 64 residents. So we had a good response in getting folks to respond back, we're telling us that we do have beds available to help this facility. So we got about 85 facilities that responded within 20 minutes of that notification being sent out that they can provide support. So this is one of the real world experiences or responses that we went to, where building your coalition and getting these special population facilities involved in your coalition transition to a smoother process when there's an event like this happen. This was a no-notice event. We had a lot of support from our local special populations group. We had our ambulance strike team out there to support this facility. The facility did its job as well. One, they went ahead and contact their transportation provider. Two, they contacted some of their contracted facilities or sister facilities to move some of the residents. So they did that process, but all this helps during your exercises that you implement when you get them involved. So this is one of our facilities that was very involved in what we're doing. One of the lessons learned we can take away is when we conducted the after action for this event with the facility and those that were involved in it. Lessons learned was this facility had to close down and it shut down and had to terminate all of its employees because it was not operational, but because it was hit by the tornado. So the agency did not, and we did not. It was an oversight on our part and all of our other responding agencies to provide that behavioral support for the staffing for this nursing home. So they were still going through that traumatic experience from this tornado. So lessons learned now is any type of event, we make sure we get our behavioral health teams to provide that support to them, to the staff. So those lessons learned. August 23rd, we had in the Beaumont area, we had severe drought in August that affected dialysis clinics and also affected the hospitals. So how did the drought affect this? Was, well, the local city water plant was no longer able to utilize its normal way of providing water to their community. So they had to go and pump water out of one of the rivers through there. So they had to change their chemicals that they use for the water to desalinate the water for use and for drinking purposes. However, with the increase of that chlorine within that water, it affected the dialysis clinics that they could not, it failed their water testing, so they could not dialyze any of their clients for several days. And so they had to send all their patients to get dialyzed at the hospital. The hospital was not aware of the situation. They have brought in water tankers to support the hospital operations, but they were not aware that dialysis were being affected. Us as a coalition, we did not know until the hospitals call us and say, we have all these dialysis patients coming in because they can't dialyze their patients. So we find out that the reason why, because they had to, the water was changed due to the chemicals to make it usable for the public, but it was not usable for dialysis clinics. So that collaboration with our dialysis corporate offices improved a lot of the response, that they started bringing in water tankers for the dialysis centers that they had there, but also it improved that collaboration with the city public works office, the city and the hospitals to discuss what was going on with the water issue. So the city and the public works were having daily calls that included the dialysis centers, which in the past they were not involved because they were not part of or they even had a foresight over that. So we went ahead and included the dialysis centers within that call. And so they started having daily calls. So now when something happens moving forward, they're going to get these dialysis clinics involved in that discussion. So that's one of those things where you get your folks involved, it improves response. January 24th, we had a thunderstorm of severe weather come in, affect power outages in a lot of our nursing homes and dialysis clinics for a few days. So we collaborated with dialysis clinics to make sure they were on generative power or with our power company to get them back up and restored. Nursing home facilities, we just make sure that we coordinated with them to make sure they have fuel and those resources to continue their day-to-day operation at the nursing home. So this is kind of like a precursor of what happens on July 2024, working with nursing homes and dialysis clinics when they had no power outages. But this was only a few number of facilities that were affected. It wasn't a big, huge number. So it helped their response. So then we go to May 2024. We had the large windstorm that caused so much infrastructure damage in like a portion of our region that the power was out for 2 weeks. So we had nursing homes that were on generator power. We had hospitals. We had dialysis centers. that were on generator power. We have folks at home that were also had no power, so they made arrangements for them to go to other locations with their family members. But our dialysis clinics had to shut down for dialysis treatment. So we were working with the power companies to give us a good ETA on when these clinics can get back up and operational. However, dialysis have to move their clients around. They really wanted to minimize that process. So we were working with them every day to find out what their status was and working with a power company to make sure that they're up and operational. So our coalition was activated for 4 days for this response, working with power companies, working with the nursing home facilities as well and assisted living to make sure they were operational or any shortfalls they may have. Luckily, nursing home and assisted living were back up sooner than our dialysis clinics. But again, this is a real world response where our medical operations was activated. We had the portion working with several of our hospitals that were on generator power. They had issues with the generator, so we're trying to support that process with our other local and state office of emergency management. So these special populations group being involved, it's easier to get them the information and get them back up and operational quicker. Our last one here, well, not our last one, recently, July 2024 was Hurricane Beryl. This one was a little different because this affected a large region that we cover. Majority of our region was we had no power from the hurricane. What I call Hurricane Beryl, I personally call it a baby hurricane because it had winds of 80-mile-an-hour winds that came in. It was barely a Category 1. But that Category 1 storm did not cause the large storm surge, did not cause flooding. What it did cause, and this is what I would always preach to our facilities, you need to be prepared for 2 to 3 weeks without power. So this storm did knock out a lot of power in our region. So the infrastructure that was in place for our power companies was down. We have power lines down. We had broken power poles. Just the infrastructure itself was damaged. So it took a while to get them up and going. So we had about a little over 130 dialysis clinics that were on generator power, or they had closed down because of that. Dialysis centers coordinated their movement to moving their clients to different dialysis for treatment. We coordinated with with those dialysis corporate offices day to day to get a good information, provide them and obtain information from them as what's your status for power, what's your generator issues, you have any issues with fuel, you have issues getting folks transportation to the clinics. So we coordinate some of that response back and forth. That communication with these dialysis centers was very important to make sure that we can get their power back up and going. So we were real close with the power company to make sure they were getting those dialysis clinics back up and operational. Again, we wanted to avoid these clients going to the hospital for treatment. Our nursing home, assisted living facilities, those facilities, our nursing homes, as for CMS required, they are required to have a generator to power the life and safety. They are required to keep a certain temperature in place at all times. Assisted living facilities, they're not required in Texas to have a generator. They are required to have life and safety ongoing. So a lot of them do have smaller generators, but they don't power the HVAC system. And they are required to maintain a certain temperature. So understanding that, working with these facilities to find out what their status was. A lot of these facilities were on generator power throughout the 2 weeks. What we did find out is generators can only be on for so long. So a lot of them didn't have a contractor for someone to come in and check on their generators. Some of them, their fuel provider was not coming in as early as it should have been coming in to refuel the generators. We were constantly working with our power company to make sure that these facilities were up and going with their power. So day to day, we would get an updated report from the power company of what the status was for each of these facilities that were out without a power. So working with our state Health and Human Service Commission that oversees these facilities, they're providing us also some data of which facilities were out of power. So we turn around and provide that information to our power company so they can go out there and check on these and give us a status every day to see what's the status. How soon are we going back up and getting up on power? We would then turn around and contact the facility and say, well, look, we're working with power company. They're thinking about 2 more days or sooner that you might get power back up and going. And if it was long-term, we would tell them that we're being told that your facility is going to take about 8 days, 10 days to get power up and going because the tree lines are all over the trees are over the power lines. So they have to remove all that, all those trees to get you back up and going. So we had this constant communication back and forth with nursing homes, dialysis centers, assisted living, with our State Health and Human Service Commission, our local office of emergency management. We were operational for about almost 2 weeks for this event, a little over 2 weeks. Operations Center was. I'm only kind of giving you an overview of our special population response, but it was a lot easier to communicate with these folks because they understood what we were doing, what our role is, and they understood what their role is. The biggest gap we did find out was generators need to be checked more often than what they thought they had to be checked on. So the other thing is they were testing the generators, but they didn't have that maintenance in place to make sure they're operational for long term. You know, we provided, so there were some of our assisted living had several smaller generators that were daisy chaining each of their plugs to provide some spot coolers in their facility. So out of all these facilities, we didn't have any issues other than going to the hospital for evacuation. We didn't have folks that expired because of the issues in their facility, because they had no power and general generator power. So that's one of the biggest things that we worked with this specific group during our response. Next slide. This is what the nursing home looked like that was hit by that tornado in 2023. This is one of the wings. There's only 2 folks that were sent to the hospital for minor scratches. And everyone in this wing just happened to be at their day area when this event happened. So nobody was in these rooms when from the tornado being struck at the facility. Well, one of the other things for everyone is this facility just happened to print out their demographic sheet, that their face sheet for all of their residents that morning, for whatever reason. So that's one of the lessons learned that we push out is make sure you get a printout of your face sheets on a monthly basis so you know who's there. Everything's electronic now, but everything was out. So luckily they printed out their face sheets that morning. So they were able to identify who was there and who they had and everything else for those residents. Next slide. This one's just our response for that tornado. We have our ambulance as it makes its way. We have one of our ambulance strike teams there that you see that. It's Harris County Health ESD ambulance. That's our ambus to help support. That's another strike team from a different agency that was there to support the response. They were all checked by our ambulance strike team paramedics for all these folks to make sure they didn't have to go to the hospital or anything else. So they were all checked. So it minimized that surge at the hospitals. Only 2 folks had to go. Next slide. Hurricane Burrow, just a quick overview of our medical operations center for our response. Next slide. We're activated for this response within the City of Houston Operations Center and our Harris County Operations Center. Some of the things that we did during this, we had our daily conference calls with all of our stakeholders. We had medical coordination for patient movement for hospital side. We activated and developed our oxygen delivery for those that were oxygen dependent, that were at home. So they will call the 911 or the number that provided, and they were then sent an O2 cylinder by our strike teams. We had our MIST members there, as I mentioned earlier on the presentation, and our strike teams to go out there and swap out these cylinders for them, and then they would go every day. They were on the list, and they would check on them every day. For whatever reason, the DME providers were not going out there and servicing their clients. That's a lesson learned. We're working on that right now. We did have some mission tasks for our ambulance strike teams to go out there and do welfare checks at our long-term care facilities and our assisted living facilities as well. We had a medical shelter that we set up with our state response. So we were coordinating medical shelter transport from hospital discharges if they couldn't go home and they had to go to a medical shelter. We were coordinating that piece as well. Next slide. We were also doing wall times for our hospitals. If they had long wall time hours, we're coordinating that piece. Our EMS, the local city EMS units would transfer the patients to the hospitals, and our local strike team members, our EMS, our paramedics would be there to kind of hand off so they can be there while the local EMS went out there, made additional runs. So we had our MIS members and our strike teams come in from other parts of Texas to support the pre-hospital component at the hospital's emergency room, so they can hand off those patients and at least be there while the local EMS unit was out doing what it had to do locally. What did we do for special populations? Provided support for dialysis for their assistance to get the power back up and going. We have patients that had to get to dialysis centers. We coordinate some of those coordination pieces as well. Provided information to our hospitals for dialysis. They need to get a hold of dialysis centers. We provided the information to them. We provided with a nursing home activation. There was evacuation. We had one facility that evacuated, so we helped with that response. Patient tracking back and forth as they were brought back. Help with generators. Some of these facilities, their generators were not working. Their vendor was not able to provide them a generator, so we coordinated generators to them, provide that support. We also had some issues with generators at the locations and nursing homes where assisted living that the state had its state public works activated. So we sent teams out there to check that generator and find out what was wrong with it and try to fix it. And if it had to get replaced, we had additional support and resources to swap that out. We also helped with our hospitals with their generators. We did have some hospitals that were having issues with the generators. Again, generators were not really long-term. So we had some support with our local Texas Public Works operations and our power company to provide that support to the hospitals when they had to get a large generator to support some of their activities at the hospital. Next slide. This is some of our activation events, or some of the events that we're doing for our EMTF. Provided the 911 support in our region. They were helping with the hospital search for wall times, and then we had 92 agencies throughout the state that came out and supported our response through our emergency medical task force assets. Basically, they come under our fold at our operations center. So then we task them of what activities and missions we need them to do for us throughout our region. So that's how that works for our medical operations center. All of these units come under our umbrella for us to coordinate where we need them to go to support our region. As we know the region best that we support, we have our partners together. So we provide that operation oversight to assign them where we need that support. So this is a pick of our activation assets for Hurricane Beryl. That's all I have for the slide. Like I mentioned before, all of these activations would not have gone as smoothly if we don't involve our special populations in your coalition and your regional response plans, because a lot of these folks already knew what our role is, so they were just calling us to give us a status update of what issues they had. I think I got 2 calls from new people that were not aware of who we were, which is very great. It's a small number. That's what I want to hear. I would have 0, but we had 2 different facilities that contacted us to say, hey, my sister facility asked me to call you, or my so-and-so person that I know at another nursing home asked me to call you all for help. We need help with our generator and stuff like that. So, there's minimal cost, but it made it very seamless to get them back operational. But you provide that support to them, you build that confidence and that trust with them. And then when something happens, like an event like this, they understand, like, yeah, they were there to help us. And this is how they helped us, information, resources, back and forth coordination with them. So they all want to know what's going on. So that's how we get them involved in our coalition. And we continue doing this throughout the year. And that's all I have. Any questions that you all may have for me?
Yeah, first of all, thank you so much for all of this. I thought this was great seeing how all of these different facilities can really play in together and getting them on the same page because we know that is no easy task of getting folks on the same page, especially when it comes to preparedness, even within the preparedness world, preparedness response world. So even bringing those outside, quote unquote, outside ones in is was fantastic. There are a couple of questions that we had come in here. One of them, first one that came in, I'll just go in order as they came in here, actually asks about when your next boot camp is and can out-of-staters attend virtually for training or learning purposes.
We're gonna start having our boot camps May, June, July. They're normally in person. So that's we break it down in different 5 corridors in our area to make sure folks don't have to travel too far. So we don't do them virtual, but we are welcome to come to our boot camp. It's a whole day worth of information. I can work with you all to see what we can do to make something work for you in your area. You know how we do ours. Maybe you can replicate that where you're at. Reach out to
Mhm.
me for that. But yeah, we're gonna start doing that. And usually we don't want to start too early because we kind of want to plan it for hurricane season. Because if we do it too early, things fall out between now and May and June. So we try to schedule them towards middle of May and then June and July. Kind of do that process for us.
Perfect. Next question here asks, is the majority of this work done under HPP or FEP for funding? I guess
Um,
they're wanting about,
yeah.
and I had a question of that too, because there's you guys have a lot of assets, a lot of different pieces coming together, and I'm guessing they're wanting to see what the different funding streams are with it.
So no, we're strictly HPP. Our HPP, basically, it's basically what does the work. Our FEP, I know the FEP program has vulnerable populations, which is it's one of those gray areas because although our nursing home and our assisted living, dialysis, home health clients are all vulnerable population, but the way we look at it in our organization and through our HPP fund is anything that's an agency or a facility, that's who we're working with. Our goal is not to work directly with that individual person at home. We're working with the facilities and agencies that work with those folks, either at a facility or a home health that have or hospice that have clients in their home. So we're working with the agencies in itself, but we're strictly HPP, but we do collaborate with FEP.
Okay.
Hope that answered the
Um,
question on that one.
yeah, I think so. I mean, and this the next one actually relates to that, but I'll let you address it anyways. Where it's asking of how were the buses paid for?
Right.
Now, I don't know if that is asking about once they're activated or the initial costs
Okay.
or any of that
Okay.
stuff. So I'll let you address that how you'd like.
Okay. So I'm gonna start off with the buses for, let's say, a nursing home needs to evacuate. Their contractor fails, for example. This is only during a large activation, right? Usually when that happens, the State Operations Center for Texas activates. They activate their ambus, their bus contracts that they have with Coach Bus and Greyhound and all those companies. They get activated. So they're pushed, some of those resources are pushed to our area, to our staging location. So it's under the state activation process. So for this, for Barrow, we did have one facility that their contractor couldn't come in to move them in time because their generator was out. So they really wanted to move quickly, and their contractor couldn't bring them in. So we coordinated with the staging resources that the state had with these buses to go out there, and we just coordinated the movement, basically the patient tracking piece of those folks where they went to, and we coordinated those resources, because some of them needed an ambulance. So we coordinated that piece to move that. So the state basically provided that bus support. For the ambuses, for our ambuses, that was purchased through HPP funds throughout the different areas in the state, but it's also a collaboration with either a local jurisdiction that put some funding in there, or maybe some of the Homeland Security funding that the area gets. They'll put something in there because it's under the Homeland Security funding. There is a health and medical component, so some of them use some of that funding. So it was just a mix of both to purchase those ambuses. And the way it works in our region and throughout the state is although we may have purchased that ambus, we have an agreement with the for example, the Houston Fire Department to manage that ambulance day to day, and they can use it every day. But when we need it to be used for an activation, we need to pull it and use it for a real world event.
Perfect. This last one that's right here, actually asks, could you do another webinar on the boot camps? Sounds like the boot camps were a big hit
Yeah.
with that.
Yeah, you know what? Maybe I can work on developing, how to develop a boot camp, because you can do it. Our main goal is to get our special pops in here, but there's like you need to understand their world to make your boot camp work the way you want to make sure it works well for you, because you need to understand. The nursing homes, assisted living facilities, they're always changing administrators, so you always have to start to square one, right? They have different requirement settings that they have to meet for CMS or maybe state regulatory requirements. So understanding that piece, understand how they think, how they work. They're working with them for a few years now. These administrators are real timid about giving you information or telling you anything or asking questions. So you kind of have to pry them for that information. So it's understanding their world to develop a good boot camp. So and it is difficult, but I can definitely do something to provide some education on developing a boot camp. But those are some of the back end pieces of it, is understanding that. I can tell you right now, our first two boot camps, we didn't charge for them. And we had over 200 people sign up for the boot camp. So we made 200 folders. We found a location for 200 individuals. And we only had about 75 people show up. Right. So after that, we have a small minimal fee. We charge them $25 for the boot camp. That kind of pays for our paperwork and everything else we need. So now they do show up. And we also work with NAB to provide nursing administrator hours as well. So that's the other piece as well to get the nursing homes to come in.
Awesome.
But feel free to reach out to me, any questions that you may have. My goal is to make everyone better, have a better coalition and response for disasters.
Yes, thank you so much. So your last comment comes in there real quick. As a former nursing home administrator, I agree with everything you just said. Thank you. No, I thought this was all fantastic. I want to thank everybody. I see we're at the top of the hour, so I want to make sure I thank everybody for attending. We still have up there on the screen Mr. Cavillo's contact information, and if you have questions, whether it's reaching out to me or reaching out to him, we can make sure we get you set up, and we'll go from there. And we appreciate everybody coming in and listening in on what we had to say here.
Yeah, thank you all for your time. I appreciate your questions, and feel free to contact me if you need anything.
All right, and have a great day, everybody, and hope to see you on a future webinar.